Good day everyone, you're welcome to my YouTube channel, Everything Medical. On today's video, I'm going to be treating the anatomy of the hip joint. The acetobulofemoral joint is one of those vital joints in the lower limb. It is homologous to the shoulder joint, that is the glenohumeral joint of the upper limb region. This joint plays a pivotal role for the fact that the trunk region is concerned, because it supports the body weight while walking and transmits the force as is generated by the movement of the trunk while standing. To tell you that yes, it is a very vital joint in the human body. Okay, without wasting much of our time, let's delve into the class properly. The first thing to note about this joint is that it's a synovial joint. Okay, it's a synovial joint. Okay, the first is our introduction. Okay, what is hip joint? Hip joint is a ball and socket type of synovial joint variety that is formed between the head of the femur and the acetabulum of the hip bone. So this is the head of the femur. This is the head of the femur, or the femoral head. Head of femur or the femoral head. Why this is acetabulum of the hip bone. So this is the hip bone. Why this is the femur. Okay, so it is a ball and socket type of synovial joint variety that is formed between the acetabulum of the hip bone and the head of the femur bone. You get? So it is homologous to the glenohumeral joint or the shoulder joint in upper limb. This joint is a multi-axial joint. Why is it a multi-axial joint? It is a what? A multi-axial joint. A multi-axial joint. Why is it a multi-axial joint? Because it permits a wide range of movement. It permits 360 movement. It permits circumduction movement. So that is why it's a multi-axial joint. It is not a uniaxial joint because it does not permit a single movement. Rather, it is a multi-axial joint. Get? It is homologous to the shoulder joint in the upper limb, while this hip joint is found in the lower limb. Okay. Now we are going to be discussing next on the type of the joint it is. So our next outline is the type of the joint. Type of the joint. What type of joint is the hip joint? The hip joint is the largest ball and socket type of synovial joint in the human body. So it is the largest ball and socket type of synovial joint in the human body. So it belongs to the what? The ball and socket type of synovial joint variety. So it is ball and socket. Ball and socket. So that is all about the type of the joint. The next we're going to be discussing is the articular surface, because it's a joint. It is two articulations that forms it. So it has the articular surface. Articular surfaces. The articular surface of the hip joint is between the horseshoe-shaped acetabulum of the hip bone and the head of the femur. So there are two bony structures that forms it. One is a depression, which is concave in shape, while one is an arched surface. It is arched. so it is convex in shape. The head of the femur is convex in shape because it is arched or rounded. Why the acetabulum is a cup-shaped bony depression, so it is what? Concave in shape because it is a bony depression. So there are two things that forms it. One is the head of femur. Why two is the acetabulum? Acetabulum of hip bone. Okay, so these are the two structures that forms the hip joint or the acetabulo-femoral joint. Okay, let's discuss the head of the femur. The head of the femur, which is this, is more than a half of a sphere. It is more than a what? A half of a sphere. It is being covered by an articular hyaline cartilage, except a small pit that is located on it. There is a small pit that's located this region. That small pit is called foveae capitis. It is called foveae capitis. Foveae capitis or foveae, whichever one. So the foveae capitis in the femoral head or the head of femur is not being covered by an articular hyaline cartilage. Rather, it is being attached by the ligamentum teres of the head of the femur. You get? So that is what attaches there. So the articular hyaline cartilage does not attach on the foveae capitis or the foveae of the head of the femur. What that attaches there is the ligamentum teres of the head of the femur, because it's one of the ligaments of the hip joint. Okay. Now, the acetabulum of the hip bone, recall that in the hip bone, the acetabulum is formed majorly by the three bones that form the costal bones or the hip bone. The costal bone is an innominate bone or the irregular bone. So it is three bones that unite to form it. You get? So it is a bony depression, a cup-shaped bony depression. You get? So the acetabulum of the hip bone have three surfaces: the articular part and the non-articular part. It is the articular part that made an articulation with the head of the femur to form the hip joint. Okay, we have the three surfaces of the acetabulum of the hip bone. One surface is the horseshoe-shaped lunate surface. Horseshoe-shaped lunate surface. Number two is the acetabular notch. Acetabular notch. Number three surface is the acetabular fossa. Acetabular fossa. Okay, these are the three features of the acetabulum of the hip bone, apart from the acetabular margins and the acetabular labrum. But for the fact that articulation is concerned, these are the three features. Okay, the horseshoe-shaped lunate surface is actually the articular part of the acetabulum, while the acetabular notch and the acetabular fossa are not the articular part because they don't make any true connection with the head of the femur to form the hip joint. You get? So that is all about the acetabulum of the hip bone, which made an articulation with the what? Femoral head or the head of the femur to form the hip joint. Okay, so we have discussed the articular surfaces. The next we are going to be looking at are the ligaments. The ligaments. Okay. The ligaments. Okay. The hip joints have several ligaments. There are several ligaments that forms the hip joint that help it in the reinforcing activities of it, that strengthens the hip joint. We have up to 7 ligaments that forms the hip joint. Number 1 is the capsular ligament. Capsular ligament, or the joint capsule ligament, whichever way. The number 2 is the iliofemoral ligament, which is the ligament of Bigelow. The iliofemoral ligament is the ligament of Bigelow. I'm going to discuss it properly. Okay. The number 3 is the pubofemoral ligament. The number 4 is the ischiofemoral ligament. The number 5 is the ligamentum teres of the head of the femur. So you have the ligamentum teres. This ligamentum teres can be called the round ligament of the head of the femur. I'm going to discuss it properly as we proceed. Okay. The number 6 is the acetabular labrum. Acetabular labrum. Number 7 is the transverse acetabular ligament. The transverse acetabular ligament is actually a part of the acetabular labrum. Okay. Transverse acetabular ligament. So these are the ligaments that helps in the reinforcing activity of the hip joint. To tell you that the hip joint is a very, very important joint in the body. Without hip joint, you can't walk, you can't stand. You are limited to so many mechanical activities in your daily life. You get. So we have the capsular ligament, the iliofemoral ligament, which can be called the ligament of Bigelow, the pubofemoral ligament, the ischiofemoral ligament, the ligamentum teres, the acetabular labrum, and transverse acetabular ligament. We are going to be discussing them one by one. Okay, the first we'll be discussing is the capsular ligament. The capsular ligament. The capsular ligament. The capsular ligament can be called the joint capsule ligament. Okay. You get. It is a strong and dense fibrous capsule. It is a strong and dense fibrous sac. Because a capsule is just like something that encloses something. That is the meaning of capsule. Capsule is just like something that encloses a particular structure, you get, or a substance. So the capsular ligament is a strong and dense fibrous sac that encloses the joint capsule of the what? Hip joint. You get. It is attached onto bony structure in the hip joint. It is attached on number 1, the hip bone. It is attached to the hip bone, and 2 to the what? Femur. On the hip bone, it is attached 5 to 6 millimeter beyond the acetabular margin, the outer part of the acetabular labrum, and the transverse acetabular ligament. You get. Now, On the femur, it is attached anteriorly to the intertrochanteric line and posteriorly 1 cm in front of the intertrochanteric crest. So that is all about the attachment of the capsular ligament in the hip bone and the femur. Now, the capsule of the hip joint, is a very, very strong capsule. You get the capsule of the hip joint, it is strong on the anterior superior aspect because that is where we have the maximal stress, you get, of exertion. So the anterior superior aspect of the hip joint is where we have the maximum stress to be what? Located. While it is thin and loose on the posterior inferior aspect of the what? The hip joint. To tell you that the maximal stress of the hip joint is located anterior superiorly because the capsule of the hip joint is thick and strong on the anterior superior aspect, while it is thin and loose on the posterior inferior aspect. You get? So that is all about the hip bone and the femur in respect to the attachment of the capsular ligament and as well the work of the capsular ligament. You get? And the capsule of the hip joint as well. Okay, this is the fibrous capsule. This diagram depicts the hip joint, so we call it the hip joint. The hip joint. You get? This is the fibrous capsule. Fibrous capsule. Fibrous capsule. Okay. This is the acetabular labrum. While here is the head of the femur. The head of the femur. You get? This is the what? The head of the femur. As we proceed, we are going to be noting those structures that as well surround the hip joint. Get? The next we are going to be discussing is the ligament of Bigelow, the iliofemoral ligament. The ligament of Bigelow. The ligament of Bigelow, which can be called the iliofemoral ligament. This ligament is the strongest ligament in the body. Yes, it is the strongest ligament you have in the human body. So it is the chief ligament of the hip joint. For the fact hip joint is concerned, it's the chief ligament. You get? Okay. This is the diagram that depicts the mechanical activities of the iliofemoral ligament and the tibofemoral ligament. So we are going to be discussing the ligament of Bigelow first, which is the iliofemoral ligament. The ligament of Bigelow is the strongest ligament we have in the human body. It is an inverted Y-shaped ligament. It is an what? Inverted Y-shaped ligament that lies anteriorly and intimately blend with the joint capsule. Yes, it lies anteriorly to the capsule of the hip joint and intimately to tell you the work, it intimately blends with the joint capsule. The apex of the iliofemoral ligament is attached to the lower half of the anterior inferior iliac spine of the hip bone. So this ligament, this is the apex of the iliofemoral ligament. apex. Why here is the base? Here is the base. Okay, this is the base. All here becomes the base. From here to here is the base. So the apex of the iliofemoral ligament is attached to the lower half of the anterior inferior iliac spine of the hip bone. So this is the anterior inferior iliac spine. Anterior inferior iliac spine. Anterior inferior iliac spine. You get. And an area below and between the acetabular labrum of the hip bone. You get. Now the base is attached to the intertrochanteric line. This is the intertrochanteric line. This line here is the intertrochanteric line. Intertrochanteric line. So this is the intertrochanteric line. You get. Now, the ligament of Bigelow has three portions or three parts. Number one is the lateral thick band of the oblique fibers. This is the lateral thick band of the oblique fibers of the iliofemoral ligament. The lateral thick band. So it has an oblique fibers. Here is the medial thick band of the vertical fibers of the iliofemoral ligament. So here is the medial thick band. The medial thick band of iliofemoral ligament. So it has a vertical fiber and a large central thin portion. This is the large central thin portion. Large central thin portion. You get. So the ligament of Bigelow is divided into three portions. The lateral thick band, which has an oblique fiber. The medial thick band, which has a vertical fiber. Look at the fibers, vertical and oblique, or medial and lateral. And a large central portion, a large central thin portion. Look at it at the middle. You get. So that is all about the ligament of Bigelow. It is the strongest ligament in the body. So it is found on the hip joint. Okay. Now, the next ligament we'll be discussing is the pubofemoral ligament. The pubofemoral ligament. Pubofemoral ligament the pubofemoral ligament. Okay. The pubofemoral ligament is a triangular shaped ligament. As you can see it here, this is the pubofemoral ligament. So it's between the pubis bone and the femur. That is how it works. The iliofemoral ligament is actually between the ilium and the femur. You get. So in anatomy, we use two names to form a certain name. So they are compound names. So the pubofemoral ligament is actually between the pubis bone and the femur. So the pubofemoral ligament is a triangular shaped ligament. As you can see it here, it is triangular in shape. The base is located upward. You get. While the apex is what? Directed downward. So here is the base. Here becomes the what? The apex. This whole ligament is directed inframedially, where it supports the hip joint on that aspect. It is attached to the iliopubic eminence, the superior pubic ramus. You get. And the pubic crest. So it is attached to the iliopubic eminence first, the superior pubic ramus, and the pubic crest. Okay, so this is the, here in this region is known as the iliopubic eminence. So here is the what? Iliopubic eminence, which indicates the attachment That is the base, the attachment of the pubofemoral ligament. Call it the iliopubic eminence. So that is all about it. Recall that this is a what? Obturator foramen. Yes, which transmits the obturator nerves, obturator vessel, so that's obturator artery and obturator vein. That is when we're discussing the hip bone. Okay. So that is all about the what? The pubofemoral ligament. Now, between the medial border of the mediatic band of the iliofemoral ligament and the lateral border, this is the medial border. This is the medial border of the mediatic band of the ligament of Bigelow, and the lateral border of the pubofemoral ligament lies the site of communication of the psoas bursa. So this is the psoas bursa. This is the psoas bursa. So between the medial border and the lateral border of these two ligaments present the site of communication of the psoas what? Bursa. So here is known as the site of communication of psoas bursa. Site of communication of psoas bursa. Yes. Okay, so that is all about it. So this diagram depicts the what? The ligament of Bigelow and the pubofemoral ligament. So we have ligament of Bigelow and pubofemoral ligament. So that is all about it. So that is what the diagram is telling us. Okay. So the next ligament we'll be discussing is the ischiofemoral ligament. The ischiofemoral ligament. The ischiofemoral ligament is relatively a weak ligament. Yes, it is what? Relatively a weak ligament. Although it supports the hip joint, the capsule of the hip joint posteriorly. And above, it is attached to the ischium. You get? And posterior inferiorly to the acetabular labrum. You get? So that is all about the ischiofemoral ligament. It is relatively a weak what? Ligament, but it supports the capsule of the hip joint posteriorly and also attaches above to the ischium and posterior inferiorly to the acetabular labrum. You get? So that is all about the ischiofemoral ligament. Because that is between the ischium of the hip bone and the femur. That is why it's called ischiofemoral ligament. So the next we will be discussing is the ligamentum teres. The ligamentum teres is actually, it can be called the round ligament of head of the femur. The ligamentum teres can be called the round ligament of head of femur. It is a flat triangular ligament with its apex attached to the fovea of the head of the femur, and base is attached to the transverse acetabular ligament. It is ensheathed by a conical reflection of the synovial membrane, but it does not support or increase the stability of the hip joint per se. This ligament does not increase the stability of the hip joint, but it is ensheathed by a conical reflection of the synovial membrane. What does it do? It creates a passageway for an artery. That means it permits the passage of an artery to the what? The head of the femur. Those arteries are derived from the acetabular branch of the obturator artery and the medial circumflex femoral artery. You get? So that is all about the ligamentum teres. It can be called the round ligament of the head of the femur. It is a flat triangular ligament with its apex attached to the fovea of the head of the femur and base to the transverse acetabular ligament. I've told you that it is being ensheathed by the conical reflection of the synovial membrane, and it does not increase the stability of the hip bone. So that is all about the ligamentum teres, which is being transmitted or being that provides site of attachment by the fovea of the head of the femur. You get. So the next ligament we'll be discussing is acetabular labrum. Acetabular labrum. Acetabular labrum. Acetabular labrum is a fibrocartilaginous rim or a ring that attached to the acetabular margin. You get. Is a fibrocartilaginous what? Ring or a rim that is attached to the acetabular margin. Recall that it deepens the acetabular, it deepens the acetabulum of the what? Hip joint. Yes, it deepens or it increases the depth of the acetabulum of the what? Hip joint. So it is a fibrocartilaginous ring or a rim that is attached to the what? Acetabular margin. You get. So this diagram here depicts the acetabular labrum of the what? Hip joint. So this is acetabular labrum. This is the acetabular labrum here. So here is the head of the femur. This is the head of femur. This is the acetabular labrum. You get. It increases the depth of the acetabulum. Do you get? Now this ligament is that here is called the ligament of head of the femur, which can be called the ligamentum teres. Ligament of head of femur. You get. This is the transverse acetabular ligament. The transverse acetabular ligament. Transverse acetabular ligament. Transverse acetabular ligament. You get. We'll be discussing it in next. So the acetabular labrum is a fibrocartilaginous ring or rim that is attached to the acetabular margin of the acetabulum. You get. So that is all about it. Do you get? So what we'll be discussing is actually the last but not the least, which is the transverse acetabular ligament. The transverse acetabular ligament. Okay, watch this diagram here. This is the transverse acetabular ligament. What does it do? It is a part of the acetabular labrum, which I've said earlier when I started the class. The transverse acetabular ligament is a part of the acetabular labrum. It converts the acetabular notch into a foramen, which transmits the acetabular vessels and nerves to the head of the femur. You get. Although it is devoid of cartilage cells, per se. So that is all about the transverse acetabular ligament. It is a part of the acetabular labrum, which converts the acetabular notch into a foramen, which transmits the acetabular vessels and nerves. Okay, we have done justice to all the ligaments of the hip joint. Okay, the next we'll be discussing is the stability. The stability of the hip joint, the acetobulofemoral joint. Okay, the stability. Every joint has a stability. The vital joints in the body has stability. Right? So the number one stability of the hip joint is the depth of the acetabulum and the narrowing of the mouth of the acetabular labrum. You get? So the number one stability of the hip joint is actually the depth of the acetabulum and the narrowing of the mouth by its acetabular labrum. The number two stability is the three strong ligaments. What are these three strong ligaments? Number one is the ligament of Bigelow, which can be called the iliofemoral ligament. Number two is the pubofemoral ligament, while the last but not the least is the ischiofemoral ligament. Okay. The number three stability of the hip joint is actually the surrounding muscles. And what are the surrounding muscles? It is the gluteus medius and the gluteus minimus. Okay. The number four stability of this joint is the length and the obliquity of the neck of the femur. The length and the obliquity of the neck of the femur. So those are the four stability of this joint. So the next in line that we'll be discussing about this important joint in the lower limb is the relation. The relation. So it has four relations. One, anterior relation. Two, posterior relation. Three, superior relation. Four, inferior relation. Anteriorly, it is related by the following. We'll be starting from the anterior relation. Anterior relation. The number one structure that is related to the hip joint anteriorly is number one is the tendon of iliopsoas muscle. Number two, the femoral nerve that passes in a groove between the iliacus and the psoas muscle. Number three is the femoral artery that passes in front of the psoas tendon. Number four is the femoral vein that passes in front of the pectinus muscle. So these are the structures that are related to the hip joint anteriorly. Let's dive into the posterior. The posterior relation. Posterior relation. Posteriorly, it has a wide range of structures, a wide range of musculatures or muscle. So the number one structures that are related to the hip joint posteriorly is number one is the piriformis muscle, the superior and inferior gemelli muscle, the obturator externus and internus muscle, the gluteus maximus, and the quadratus femoris muscle. So those are the muscles that are related to the what? To the hip joint posteriorly. Then the number two of them is the superior gluteal nerves and vessels above the piriformis muscle, the inferior gluteal nerves and vessels below the piriformis muscle. You get? That is for number three. Number two is superior gluteal nerve and vessels above the piriformis. Number three is inferior gluteal nerve and vessel below the piriformis. Number four is the sciatic nerve, the posterior cutaneous nerve of the thigh, and nerve to quadratus femoris. Okay. Now let's delve into the superior relation. Superior relation. Superiorly, it is related to the reflected head of the rectus femoris laterally. It's related to the what? Number one is reflected head of the rectus femoris laterally. And number two is the gluteus maximus, minimus, and medius, medially. The gluteus maximus, minimus, and medius, medially. So those are the superior relation. The next is the inferior relation. Inferior relation. On the inferior relation, we have the pectineus muscle and the obturator externus. So those are the two structures that are related to the hip joint inferiorly. Number one is the pectineus muscle. Number two is the obturator externus. Okay, so those are the structures that are related to the hip joint inferiorly. So we are done from the relation of the hip joint. The next we'll be looking on is the bursa. The bursa. Okay, the bursa. Number one, bursa, we have the bursa. Number one, the hip joint has up to 7 bursae, but we'll be looking on some of them, not all of them. We have number one, the trochanteric bursa. The trochanteric bursa. Number two, the subgluteal bursa. Let's start with psoas bursa. Number three, subgluteal bursa. Number four, the ischial bursa. Number five, we have the psoas bursa. So these are the bursae of the hip joint. The trochanteric bursa is actually a very, very important bursa. It's a vital bursa. You get it is found between the gluteus maximus and the lower part of the outer aspect of the greater trochanter. But before I continue with this bursa, recall that the 7 bursae of the hip joint are distributed around or below the structures that surrounds the hip joint. You get 4 bursa are located below the gluteus maximus. 1 is located below the gluteus medius. 1 again is located below the gluteus minimus, and 1 again is located below the psoas tendon. Get so that is why there are 7. 4 is gluteus maximus. Then the rest of the 3 are located below the gluteus medius, minimus, and psoas tendon. Get so that was a clarification about how the bursae are being distributed in the hip joint. Okay, the psoas bursa, the psoas bursa is located between the iliopubic eminence and the psoas tendon. It's located between the iliopubic eminence and the psoas tendon. That is for subpsoas bursa. Then the subgluteal bursa is located between the gluteus maximus and the ischial tuberosity. The subgluteal bursa has a clinical relevance. Yes. For those that does a work that they sit too much, like they sit too much on the seat, such as office work, you sit from morning to night, you could develop what we call Weaver's bottom, because there could be inflammation and enlargement of the subgluteal bursa. get, which will develop what? Reversed bottom. So that is a clinical relevance that is associated with the subgluteal bursa. It's located between the gluteus maximus and the ischial tuberosity. Okay, the ischial bursa is as well located between the gluteus maximus and the ischial tuberosity. Now, the psoas bursa is located between the medial thick band of the ligament of Bigelow and the pubofemoral ligament. Now, the number 6 bursa we have here is the gluteofemoral bursa. Gluteofemoral bursa. This bursa is located, like, is a very vital bursa. Is a what? A very vital bursa. It's located between the tendon of the gluteus maximus and the vastus lateralis muscle. You get? So it is called the gluteofemoral bursa. So these are some of the bursa of the hip joint. Okay. The next we'll be discussing is the blood supply. The blood supply. Number 1 is the medial circumflex femoral artery. Number 2 is the lateral circumflex femoral artery. Number 3 is the obturator artery. Number 4 is the superior gluteal artery. Number 5 is the inferior gluteal artery. So these are the blood supply of the hip joint. Okay, I think let's delve into another important outline, a vital outline of the what? Hip joint, which is the nerve supply. The nerve supply. What are those nerves that innervate the structures around the hip joint and also the hip joint? Number 1 is the femoral nerve via the nerve to rectus femoris. Femoral nerve via the nerve to rectus femoris. Number 2 is a branch from the anterior division of the obturator nerve. Number 3 is a branch from an accessory obturator nerve. Number 4 is a branch from the nerve to quadratus femoris. Number 5 is a twig from the sciatic nerve. It is occasional. A twig from the sciatic nerve. So those are the nerve supply or the nerve innervation of the hip joint. The next we'll be discussing is the movement. Yes, the movement. Okay. But before we discuss the movement, let's label this diagram. Let's label it. You get? Now, these are the acetabular fat. Acetabular fat. Here is the ligament of the femur. Ligament of femur. This is the transverse acetabular ligament. Transverse acetabular ligament. This is the zona orbicularis. Zona orbicularis. Because that here and here is the fibrous capsule. You get? Now this is the reticular fibers. So those are the labelings. Okay, let's dive into the movement. The movement. The hip joint permits wide range of movement. It permits wide range of movement. Number 1 is flexion and extension. Number 2 is medial and lateral rotation. Number 3 is adduction and abduction. Adduction and abduction. Number 4 is circumduction movement, which is all classified inside this 3 movements. In circumduction movement, all these 3 above movements are inside it because it is a 360 movement. Circumduction movement, we call it 360 movement. Okay, flexion and an extension movement is like they move around a transverse axis in the hip joint, while medial and lateral rotation move around vertical axis. You get? Now, adduction and abduction movement, they move around anteroposterior axis in the hip joint, while circumduction movement is a 360 movement. It moves in all axes. Okay? So that is how it works. Flexion and extension is your transverse axis. Medial and lateral rotation is vertical axis, while adduction and abduction movement is what anteroposterior axis. Okay, next is the clinical relevance. The clinical relevance. Clinical relevance. Number 1 is dislocation. 1 is congenital dislocation. Yes, we have 2 types of dislocation of the hip joint. 1 is congenital dislocation, while 2 is acquired dislocation. In congenital dislocation, it is being caused by the joint capsule being loose at birth. There are 2 factors that causes congenital dislocation of the hip joint. 1 is when the fibrous capsule becomes loose at birth. You get? Number 2 is the hypoplasia of the acetabulum and the femoral head. So those are the 2 factors that causes what? Congenital dislocation of the hip joint. 1 is when the joint capsule becomes loose at birth. Number 2 is hypoplasia of the acetabulum and the femoral head of the femur. Okay. Then acquired dislocation is caused by an automobile accident. You get? A car accident, because it is a trauma. You get? So it is that trauma that can cause it to get dislocated, because the hip joint is a very stable joint and mobile joint. So the only thing that can cause it to get what? Dislocated under acquired dislocation is a motor accident or an automobile accident. Okay. Then the number 3 is Weaver's bottom. Weaver's bottom. Weaver's bottom occurs as a result of inflammation or enlargement of the subgluteal bursa. You get? When it gets inflamed, it could result to what? Weaver's bottom. So it mostly occurs in people, or being prone to people that sit for too long in an office, such as office workers, because it will get inflamed. We call it Weaver's bottom. Okay. The number 4 is osteoarthritis. Osteoarthritis. Yes, there could be inflammation of the joint. You get? There could be inflammation of the hip joint. We call it osteoarthritis. Inflammation of the joint region. You get? Now, the number 5 could be referred pain of the hip joint. Referred pain of the hip joint. You get? because the nerve that innervates the knee joint innervates the hip joint. If there's any inflammation or any injury to the knee joint, there could be pain sensation transmission to the hip joint. We call it referred pain of the hip joint. Okay, I believe we have done justice to the anatomy of the hip joint, which can be called acetabulo-femoral joint. We have discussed everything ranging from the introduction to the clinical relevance. I know you enjoyed this class. Thank you so much for staying to the end. Endeavor to click to the subscribe button and subscribe, and as well share across to your colleagues in medical school. Thank you so much for staying into this class, and I appreciate you. Thank you.